Tennessee Death Row Dogs, your local dog rescue nonprofit. Talkopolis, the social media TV network for your city.
I'm TJ Cates again with another episode of Nashville's Best. We're here with Dr. Russo of the Kyro Chiropractic Clinic in Franklin. Yeah. Welcome back.
Thank you. Thanks for having me.
Well, thanks for coming back in. Let's touch on some different topics than we did last time. Tell me about some new machinery that you have.
We've got some new traction. Their traction units. What we use is for curve correction. We get this question a lot: is do you treat adults? And the answer is yes, we do. We use a technique called CBP, which is chiropractic biophysics, and it's a little bit more in-depth process as to the structure and function of the spine and how it affects the organs, which is really the bigger picture. And so what we do is we do an in-depth analysis exam, X-rays if needed, that tells us what the structure of the curves are of the spine, where they are versus where they need to be. And we've implemented a new system of state-of-the-art traction from CBP that helps to restore those curves to where they are supposed to be so that we can restore the body back to a state of health and wellness.
Okay, I'm going to throw you a curveball because this is something we didn't talk about yet. When you have adults that come in, sometimes people are a little bit older or they've had work injuries or maybe 10 or 15 years before they had a sports injury. And they really don't want to do the surgery that a regular, a hospital physician or something like that's trying to get them into. How would you kind of bring them in and make them feel comfortable with trying this? Because I know it's going to work.
Yeah, I think the way we handle that is by answering any objections or questions that people might have and trying to educate about what we do, because we don't take every patient, in all honesty. There are some people who, we have strict requirements to become a patient in our clinic. Right. And that is, in order for us to provide the quality of care that we are known for, we want to make sure that that patient is committed to the care. And through our analysis, when we do a consultation with a patient to find out if they have a condition that we can help them with, then we do, if necessary, examine X-rays. And that will lead us to whether or not it is a condition that we can help them with. And at that time, we go over what it is they have and how we can help them, if we can help them.
That's great. I mean, I know so many chiropractors have helped so many different people and kept them out of the operating room.
Absolutely.
I think that's great.
Absolutely.
So let's talk a little bit more about your business. You just did a remodel.
Yes, we did.
It's pretty exciting.
Some renovations, yes. We're very excited about it.
Okay. Yeah. Well, that's good. What did you do different? I mean, just kind of give it a facelift?
We've some aesthetic stuff. We're growing, and in the process of that, we're trying to create space so that we can adequately provide the same quality of care to all of our patients, and we're doing that with the state-of-the-art traction and rehabilitative therapy that we're doing with our patients, and we're getting some really great results with it.
That's
I'm really
excited.
Good. Yeah, I'm really excited.
I'm excited for you.
Thank you.
Let's talk about something that may be common that somebody's watching the show, and they have never been to a chiropractor, and they're a little bit leery, and they've all heard little stories. What are some things that maybe some people have heard, and what do you do to make them feel better about it?
The question we get a lot is it safe, or is it a condition you can help me with, or maybe they've heard something negative about chiropractic, and my first question is, well, what's been your experience? Have you been to a chiropractor before? If not, tell me why. Tell me what do you know, and what validity is there, and we like to educate and say, okay, well, this is what we are, and this is what we do, and this is what makes us unique and sets us apart.
And I would imagine once they get in there, they find out how it really does help them, and maybe get them off for medicine and get them in there, and then they can live just so much better of a life. You get a referral business going on there.
Yes, that's probably the majority of our patients is referral, and not just other patients, other providers, other doctors refer patients to our clinic as well, which is a big deal in our world.
And starting with these children at a young age, like you do, which is wonderful, I would imagine maybe it's going to help them because kids play sports, and they play sports hard now.
Absolutely, TJ. I say this often, as adults when we come in and we have, the postural distortions or the degeneration, the wear and tear that they have, a lot of these things start in childhood. So if you could prevent your children from having to go through what you're going through, that's why I say we like to get all kids checked, because these issues start when you're this old, or even at birth. Some things start at birth too. So it compounds over life. If you've ever watch kids play, how many times do they fall in an hour?
A lot.
A lot.
A lot.
A lot. So you want to make sure you get that checked so that they can be on the path to health and wellness, not sickness and disease.
That's nice. That's very nice. Okay, now let's talk about the prenatal care that you do.
Yes.
Because that's on your website, and there was a video that I watched, and that's really interesting to me that you have somebody that's already had a couple children,
yes,
and had a little tough time, and then they come in and they deal with you, and it's so much easier.
She did. I think this was her fourth, and we had some pain, some low back pain, some sciatica, which we were able to help her with, and we were able to help her get a really good birthing experience. I believe she had that baby in under 2 hours. And it was a really great natural experience, the way she wanted it, and it was really good that she had a drug-free experience. And I'm happy. She's very happy with the way it turned out.
She seemed kind of happy, and So that did she have her baby yet from the video?
Yes,
she did.
She had a while ago.
Because I saw the before.
Yes, she had her a while ago. We've actually been able to help a lot of patients. We've had 4 new babies from our pregnant patients come into the world this week, and all
this week.
All have been really great experiences.
I bet it's great when they actually bring their baby into you.
Yes, that's my favorite.
That's
I
so
think
cool.
That's my favorite is when we can do the newborn spinal screening, and I say that's a really good thing to get checked for. The #1 cause of SIDS is actually studies have shown that it's an inverted atlas, which is the very first vertebra that comes out of the neck. I'm sure you've heard of this before. It's shaped like a circle. It's inverted in the base of the skull, the foramen magnum, and it can sever nerve interference from the brainstem coming down to the body, and that cuts off that energy flow that goes to the vital organs that's necessary for life. And it's a very easy adjustment, and it's if it's something that could save their life or change their lives and keep them healthy and maybe a little bit happier, then
it's just so incredible the different things that you do.
It's amazing what chiropractic does. I love it.
It is, and I'm a big fan. Okay, well thanks for coming in.
Yeah, well thanks for having me.
Okay. Well, this has been TJ Cates with another episode of Nashville's Best, here with Dr. Russo of Kids Kyro Chiropractic Clinic in Franklin. So go to our website, contact her, make a visit, and I think you'll be glad you did.